I don't think there's enough words to express how devastating it is to not have enough PPE for those people who need it.
From our perspective, if they weren't getting it from us, they weren't getting it anywhere.
The whole hospital was on lockdown. Our N95s, we were given one, and you had to put them in a Tupperware box that had a little punch of holes in the top, and we'd had to use those constantly. That's all you got was one.
We're in the place that is the single greatest place to pass it forward. I take care of one patient, I don't know that they've had it, I then go take care of my next patient, I then go talk to my colleagues, I go have lunch, I move all around the building, and I go home, and then I give it to my kids and they go to school.
In this crisis, the global channels broke down. Our country wasn't able to get the PPE that they normally did from the channels they normally do.
There wasn't the supply on hand, and there wasn't the supply chain to get it on hand.
Local manufacturing became a necessity, and our spaces had the shops and capabilities to be able to create these products. Technocopia is a makerspace and incubator. Makerspaces and incubators provide space, tools, machines, shops, and other resources so that people may design, learn, and make things.
WorkLab is a startup incubator, and we provide resources to help lower the barrier to entry for new businesses. We had all these members that were looking at the headlines of hospitals can't access PPE, there isn't any PPE, and thinking about, well, what can we do?
One large way that makerspaces and incubators could provide was by making personal protective equipment that was at a loss in many of the healthcare systems at that time.
We started doing a lot of online research, started getting out there talking to nurses, healthcare professionals.
We worked closely together for months, trialing different variations of masks, design, testing.
Technocopia produced almost 10,000 face shields that went out to the state of Massachusetts, and collectively that number is much higher if you talk about the WorkLab and other makerspaces in the state nearby.
They've been extremely helpful, and everyone has volunteered their time, their filament, their 3D printers, their ideas. They made face shields for us. And they made the 3D masks.
Seeing the pictures of actual healthcare workers wearing a face shield with a thumbs up, knowing that they're going in, helping keep everyone safe, as well as still addressing the normal flow of people who needed surgeries and needed, healthcare attention pre-COVID, is just really rewarding.
It was a very effective and immediate solution that allowed people to redirect then their energy to the next thing that they really had to face.
Those face shields were absolutely lifesavers for our folks.
The WorkLab and Technocopia provided a solution in a time when a solution didn't seem affordable or accessible.
Our message is that, spaces such as Technocopia, WorkLab, and other incubator and maker spaces out there, we're here and we want to help. We can help. We have the capacity, we have the equipment, the talent, the knowledge to do so.
Talking about the problem, researching the problem, experimenting and tinkering on solutions, coming up with a model, having a solution, and then executing fully on that to then see that product out in the community and being able to evaluate it and make changes on it. That's some of what the maker movement is all about.
Our efforts would not have been possible without the support of St. Vincent's Hospital, the Massachusetts Nurses Association, our entire community of members, as well as our GoFundMe donors.
Nothing ever stays the same, ever. And I think every day that we engage that idea, we become better problem solvers and innovators. And that kind of moving, fluid mentality about how you can improve your space in the world, I want some more of that.